The eclipse happening in exactly 1 week. Final preparations are underway. Today, Bosque County declared a local state of emergency due to the total solar eclipse, and other entities are sharing their plans for the big event.
Local first responders and healthcare systems are anticipating Eclipse Day to go as smooth as it can, but they also have plans in place in case there are emergencies. At Advent Health Central Texas,
We want to make sure we're ready for anything that our community needs.
Kevin Roberts, the president and CEO, says they've been planning for months for the challenges that could come with the total solar eclipse.
We're not worried, but we're prepared. It's the cell coverage, computer outages, those sorts of things. So we have to have alternate methods of communication.
Roberts says with the population dramatically increasing for a few days, they are ensuring they're prepared to provide the care.
Having additional staff, particularly in our emergency department, because that's probably where people will need us the most. Our clinics are still open on the outskirts of the hospital, but the outpatient services have been curtailed.
Advent Health Central Texas will also have traffic control to ensure their lots are for hospital visits only.
Keep the roads open. That is the most important thing, is to be able to have access to the campus of the hospital.
It's what American Medical Response Temple EMS is focused on too.
We have to have roads to get to our patients, so yeah, dealing with that congestion is potentially going to cause some issues.
Operations Manager for Temple EMS, Byron Sedlacek, says response times could be impacted. That's why they're working with local fire departments to ensure medical care doesn't miss a beat.
They can actually deliver care, they can start treatment on the patients, even if the transport aspect of it is delayed because of response times, traffic, and crowding.
Temple EMS will also have increased staffing and will be strategically located around Bell County.
We do have plans to potentially locate some of our ambulances at other fire department stations to get them a little bit more dispersed.
Because in these moments, seconds matter most for the patients and first responders. In totality, is keeping everyone on their toes.
With an event like this, it's a best guess, right? And then you just determine how your responses are depending on what happens. So you are kind of looking at making adjustments on the fly.
Well, it should go without being said, but first responders and healthcare professionals are stressing to keep the 911 lines open for emergencies that need immediate police, fire, or medical attention. And also stay home if you can, because the less vehicles traveling about, the better.